the revision surgery March 22nd, so it's been about 7 weeks now. They told me after the revision surgery to not really do any leg exercises for 4 to 6 weeks, so it's frustrating for me. It was actually the hardest part of this entire experience because when I was down in the hospital the first couple months, you know, you got so many injuries, so many broken bones that you have no choice but to stay down. But when you've been active doing physical therapy and gym time, to say, hey, now you gotta take a time out for 6 weeks, that was really hard for me. But I knew the main thing was I needed to let this heal and get back at it. So it feels so good to be in here, and it feels really inspiring to be able to even do a lunge and to see that I can do that again. Work's been great. It's actually ironic because since the revision surgery, I've done 2 commercials, which is a big deal for me because the next step I have in my recovery is a rhinoplasty because I can't really breathe out of my nose. I have a deviated septum. So it's gotten in my mind a little bit mentally that my face is not what it was. So I didn't think I'd be doing any commercial modeling, but luckily I got to do a commercial for an air conditioning company and a mask as well, a protective mask. So very happy for that. It came unexpected and it gives me confidence from this point moving forward. We're gonna do a PRP injection.
So it's plasma rich or platelet rich plasma, so it's gonna help with regrowth in like a torn joint. Some people use it for like in a face, for like wrinkles. It helps your body like regrow using itself. It's really cool science. Keep pumping for me.
I've never done this before, so I'm excited.
It's really got famous after Kim Kardashian did it, like the vampire facial. It got really popular after that.
But you can use it in your entire body,
exactly.
Not just face,
yeah, exactly. It's the same idea behind all of that.
Nice.
Okay, 1, 2, 3. How are you doing? Doing okay?
I'm doing great.
There's tons of trauma in here and scar tissue and damage that was done, and it's still pretty tight. So I think a PRP, the way PRP works, it releases a bunch of growth factors to help heal, break down cartilage, generate new cartilage, and actually makes new blood vessels too, so it increases blood flow. So there's a lot of things. So I marked the spot. That's where I usually go in the knee. You can go into the knee anywhere. It's a big joint, but this is typically my favorite spot here. We're using a super strong cleaning solution called chlorhexidine, which kills bacteria for 6 hours. And this is all Zach. So we drew blood on Zach. There's kind of a lot of fluid, and his knee's kind of small, so we'll see if all fits in there. But you take blood, you draw it, you spin it down, and you get the plasma. You take off the top part of the plasma, and what you're left with is the platelet-rich plasma, which has all these growth factors and stuff in it. And you inject that in the knee, it releases the growth factors and helps promote the healing in the area. So that's what we're going to inject into his knee. We inject it in other places too, but knee is actually the place that works the best. Shoulders are a little tougher in some other places, but the knees are the best. So it's a small needle, so we use some freezing spray to kind of numb the area so he doesn't feel it. And then we inject the joint. Simple as that. You ready, buddy?
Ready.
All right?
Yep.
Your knee's gonna feel like it's blowing up like a balloon. It didn't even bleed, but we'll put a band-aid on anyways.
That was super easy. Wow.
Like voila! See how it goes. So you take it easy for 24 hours. See how it goes. You don't take any aspirin or ibuprofen for at least 72 hours because those kill platelets. We don't want that in this particular situation. And then should start feeling better. We'll see how it does, okay?